How do we actually drive continuous improvement when we're really trying to move those numbers? And sometimes those numbers don't move. So what do we do, Elsa?
Thank you, Erica. Erica has touched on so many important elements of CQI, which is continuous improvement management. And what I'm going to be talking to you about is how we take the initiatives of CQI and how we break it out and really utilize it with your plan. So what is CQI? Again, continuous quality initiative or improvement. And it is consistent of 4 basic elements. For the most part, if any of you, and many of you might be very involved in CQI initiatives, there's always a problem that needs to be solved. And why are we solving the problem? First of all, we're trying to increase our efficiency. We're trying to, in many cases, many organizations implement CQI initiatives because they want to reduce costs. Ultimately, it is driving quality. And we want to focus on the mission, the core elements of your organization. We want to drive quality, and we want to reduce costs, but we want to ultimately end up with excellent outcomes, and that is driving quality throughout the organization. So first of all, we have to identify that problem. What are the problems that we are trying to solve? And if you are new to CQI, and if you are trying to use dual systems with CQI, you want to first start off slow and identify which problem are you going to start with and how are we going to solve that problem. CQI involves interpersonal skills. It means getting everyone involved. CQI is going to be most beneficial to your organization. You're going to improve the outcomes if you involve every member in your team. It's going to demand teamwork. So and those go hand in hand. Interpersonal skills, working with a team, setting out ground rules for the team, but again, encouraging and empowering the team so that they can participate and drive the outcomes that you need. Quality improvement process, you are going to map out a process. CQI is all about process. It is all about measurement. Everything that Erica talked about, we're going to be touching again and wrapping it up with CQI. Typically, failure is not associated with individuals when you have CQI implemented. It's poor CQI process development. That means that a lot of work has to go into the CQI initiative on the upfront mode so that you can have excellent outcomes. Secondly, focus must be critical of business development. So when I say that upfront mode, that means that you're going to have to really pay attention to workflow. You have to focus and, again, have a clear, concise objective so that you can understand what it is that you're tackling and you know what you have to study in order to put your plan together. So let's go on and go through the next slide. First of all, and as I said, you have to develop a clear objective. What is it that I'm trying to accomplish? You have to make sure that it is concise and that it is measurable. When you have objective statements that are ambiguous or you're trying to tackle too many variables in one statement, then it is very difficult for the team to plan for, to evaluate, and ultimately to measure. So you're not quite sure what the outcome is supposed to be. You know in the background that you would like to get this done, a particular thing accomplished, but your statement isn't clear and concise. And so when, again, I live in Reno, and there's mountains on the west side of Reno, and I can always find myself if I look for the mountains. Well, your staff has to have a very clear objective. They've got to be able to find what it is that they're trying to solve, and so if the objective statement is ambiguous, then it's very difficult for them to find themselves. How will we know that change is an improvement? Again, that goes back to a clear, concise objective and an objective that is measurable. So we're going to plan, and we're going to know what the outcome is that we're trying to achieve. We want to measure. So again, Erica touched quite a bit on measurement, and it has to be a measurement that matters. what is the outcome that we're trying to achieve, and therefore, what is the best measurement that we can derive at that will help guide the team so that they know that when they're plotting, when they're putting in numbers, when they're evaluating their situation, they know exactly where they are. And that's going to be all about measurement. What changes can we make that will result in improved outcomes? So CQI is a consistent, it's continuous quality improvement. It is evaluating your situation, tweaking it a little bit, and attacking it again. I'm all about doing it right the first time, and this is what we spoke about to the client last week when we spoke to them. We had an interesting and energetic speaker that spoke after us, and she said, you're going to hate CQI, you're going to hate doing what you're doing, you are going to have to do it over and over, and you will make mistakes. Well, that is true with CQI. There will be a trial and error, but how much of it can you minimize? Because ultimately, that costs you money. So CQI is about cost containment, cost control. And so the more that you invest in the upfront planning, then your trial and error is minimized, and thereby reducing the cost of your organization. So you have to be able to define some solid measurements that will guide you through the process. Okay, so begin by understanding the desired outcome, and I've just covered that. What do we want to accomplish? So Erica's example was excellent. We can talk about numbers, but ultimately it was talking about the outcomes. Those individuals that wanted to have helped themselves through a self-management. These are people that will end up in the emergency room, that will cost the state much more money if they do not understand how to self-manage their situation. So in that case, they had very clear, definitive outcomes. They wanted to improve the health of those individuals that were self-managing at home in order to reduce the cost, the healthcare costs to the state. And so you have to have a clear objective. Now, many of you are working with the MSP tool, the online MSP tool, and CQI may have some different nomenclature that you're using. Typically, a CQI works with initiatives. Ultimately, you have to have an objective. So that's the one similarity is you do have an objective, and that can translate. Then, as far as key actions, what are the initiatives? What are those action items that you're going to have to perform in order to have the outcome that you want? So in MSD, what you're going to see is key actions. And so what are those key actions? And they are going to be assigned to the various members of your team. And then how are you going to measure them? What are the ultimate measurements? And again, they have to have a purpose. Now again, in some cases, you're going to have to quantify them. What are the numbers? But in most cases, you are driving to a positive outcome. So make sure that your measures are meaningful. Then, document and study. CQI is all about documentation. How did this work? What was the outcome? How are we going to have to slightly improve? If they had gone in with certain initiatives to train these individuals on how to self-manage their case situations, and it wasn't working initially, they were going to have to go in and revamp their initiatives a little bit. So CQI is all about documentation and evaluating your documentation before you move on and make changes. So you want to make sure that the changes are also meaningful and that they will move you in the positive direction. Then ultimately you will have reports. The great thing about the MSP product is that it does provide you with some excellent reports that you can see on how you're doing as far as your performance. Now, lastly, with CQI, you will probably have some other tools for reporting, and these are going to be tools that may be some very concise measuring goes on. All of those can be tied into the model. Ultimately, what you want to do is celebrate the achievement through the processes. Okay, so this will take us into what the next steps are. Now, again, empowering the people as you go through is a critical component of CQI. Erica touched on it. Before I go into the next step, Erica touched on empowering your team. Keeping your team focused, keeping them moving the needle in the positive direction. And so she talked about pebbles and rocks and stones. CQI is a program of many initiatives. Make sure that your team is empowered to perform the initiatives that they have been assigned. So the important thing is you don't want to give one team member a rock if they're only empowered to move a pebble. So keeping that in mind, what are the next steps? First of all, pick a process or a problem. Obviously, in all organizations, we have processes and problems that really are cumbersome and they're costing us money, they're costing us some inefficiencies, and again, mostly sometimes they're costing us people. So pick your problem and determine what the essential components of that problem is or are that you need to improve. So refine and revisit the objective you're trying to solve. Look at the problem, determine what the objective is that we're trying to solve, and define that objective as clearly and as precisely as possible. Identify what the favorable outcome is. Again, know where the mountains are. Know where the staff is driving. Make sure that the staff all knows what they're driving to. And again, ultimately, it is all about positive outcomes. List your action items to improve the process. So we listed our action items to go through the process for improvement, and then we're going to study it and we're going to revise it. Again, look at it very critically. Do not make changes for the sake of changes. You know, in reference to the speaker that I brought up, she says you're going to make changes, you'll just do it over and do it over until you get it right. Think about this and put this in your thought process. Make sure that you definitely know that you're going to go through revisions to your process, but make sure that your revisions count and that they're not costing your company more money than actually performing cost-saving measures. And then implement and track. With everything you're going to implement, you're going to track. Maybe it's metrics, percentages, numbers, however you decide that your processes need to be quantified. It's important that you understand and that everyone understands how you're going to be quantifying your process. And then you're going to do it again. Unfortunately, CQI and those lucky individuals that get it right the first time really front load. Go into it understanding what the process is going to be, work through, give it a lot of thought, understand how you're going to measure it, and then ultimately you'll get the outcomes that you set out to get. So those times that you will have to do it again, make sure that your changes are going to count, that they're moving you towards a positive direction and that they're moving that needle.